We had a little Red Cross outpost hospital, and it served the community very well. But now there's talk of doing away with our hospital.
There hasn't been talk from my end.
No, not from your end.
But I know there was some people came around earlier, a couple of months ago, and had hearings.
Yes.
That wasn't the government that was coming around.
I realize that, but my point being that when we get kicked with that, now we're getting hit with no drugstore, no pharmacy. This is really the upsetting point. If they do away with what they're talking about doing away with, 95% of our population here are seniors.
Absolutely.
Then, if they do away with that, 95% of our seniors are soon going to be without driver's licenses. Where is that going to leave us?
Oh, I know. Listen, that's why I came here today.
We have to drive approximately 150 miles to the nearest city. How can we do that with no driver's license? How can we do that with no inter-transportation? Buses?
Oh, yes, exactly. And like I said, that's why I came here today, to hear your concerns and to work so there's a lot better understanding. But once again, we got to get everybody back to the table.
But then when we're so far away, how can we be classed as urban when we're rural? This is the thing that gets
Well, and that's where we have to get the details worked out on what's urban and what's rural and find out. And that's why we got to sit down and work, because if somebody in Toronto says Minden's urban, I have an issue with that. What we have to do is bring the people in who are actually here and figure it out. And I'll make sure that happens, because I'm very aware that this isn't urban.
Oh, this is desperate. This is desperate, very desperate.
So, Rick, would Fenland be rural as well?
I'm not sure how as it breaks down, you know. I mean, we have to sit down and work out all those, find out the details, which is what I've promised to do, is find out the details on how.
Because my demographics are similar to Minden's as well.
Yeah.
And the policies would hurt my patients equally well, as much as it does hurt the Minden patients.
No, and it's finding out what that definition is, but that's only going to happen if everybody gets back to the table, sits down and discusses it, works it out.
Okay.
You know?
And so I would like to present you with all our signed petitions.
Thank you.
And I would ask fervently that you present them in Parliament post haste, so we can get this decision kind of settled once and for all.
Okay, now these are all originals, right? Good.
Yes, they certainly are.
Excellent.
And thank you very, very much.